Oh, can you see my full screen?
Yes. Kijin Seong is a postdoctoral fellow in the Urban Information Lab in the School of Architecture at UT Austin, and she's here to talk about health vulnerability and EMS response in Austin, and covering spatial disparities and shaping resilience strategies. Whenever you want.
Okay. Thank you, Jose, for the introduction and for having me here today. I'm going to talk about the impact of extreme heat on the public health sector and introduce one of our recent studies on spatial disparities in emergency medical service response. This study has been worked with Dr. Junfen Zhao at UT Austin and our research assistant, Akhil Mandalapu. And we focused on evaluating the effect of heat vulnerability on heat-related EMS incidents in the Austin area. I'd like to begin by highlighting a significant and concerning climatic shift in Texas. So recent data reveals we are entering an era characterized by the record-breaking heat. So it isn't just an anomaly, and it's actually becoming our new normal. So over the past decades, Texas has experienced over 1,600 days where the heat records were matched or broken. As shown in the map here, every county in Texas has seen an increase in average temperature in the last 45 years. So as you see, West Texas, the Panhandle, and the Gulf are experiencing the largest jump in the record temperature, and Amarillo, El Paso were notably affected, with record hot days of more than 4 and 5 times the average of the past decades. As we move to this graph, sourced from the Texas Tribune article, in 2022, Texas experienced its second hottest summer on record. So the state is facing one of the worst drought in more than 10 years, which greatly raises the risk of the heat-related illnesses like heat exhaustion and heat stroke. But perhaps the most striking and concerning aspect of this data is the human cost. So the last year, Texas recorded at least 279 heat-related deaths, and this is the highest annual toll since at least 1999. These numbers are not just statistics. They represent lives impacted and lost, underscoring the severity of the situations we are facing now. So living in Austin, I've experienced firsthand the escalating urban heat exposure, sensitivity, and concerns that is increasingly evident in our communities. So heat-related illnesses can rapidly lead to the severe health consequences, including the disabilities and death. So the timely and rapid response of the EMS is crucial in extreme heat events. So our team delved into the crucial role of EMS in responding to the heat-related emergencies. And as you see, this figure presents the data on EMS incidents in Austin from May to September 2020 to 2021. And it shows the highest number of incidents occurred in July and August, suggesting the growing impact of the heat on public health and the increasing burdens on the EMS services during the hottest months of the year. So today, I'm going to introduce our study on the effect of the heat vulnerability on EMS response observed in the Austin area. Because of the data availability, I'm not presenting this year's impact, but since we've seen the effect of the heat growing up over time, I think the checking out the most recent impact will really help us guess what would be happened to the public health in the future. Previous study has extensively explored the relationship between the heat exposure and the related heat illnesses. But however, the gap still remained in understanding how the composite aspect of the heat vulnerability, which includes the heat exposure, sensitivity, and adaptive capacity, interconnect with the heat-related illnesses, particularly in the context of the EMS responses. So to bridge this gap, our study examined some key questions. First, what is the geographic distribution of the heat vulnerability in the Austin area? And second, how does the heat vulnerability correlate with the EMS services? And finally, what impact do the heat vulnerability factors have on the heat-related EMS incidents? So our goal through this study was to provide some actionable insight to enhance the efficiency of the EMS during the critical heat events, thereby improving the public health in our communities. Our study examined the Austin Travis County due to its rapid urban growth, increasing the heat island and the resulting the environmental and social challenges of its expanding population. And regarding the study period for this study, the summer season from the May to September 2020 and 2021 was chosen because the temperature in Austin are at their highest in this period. The figures on the right exhibit some heat exposure, sensitivity, adaptive capacity, and composite heat vulnerability index in Travis County. So overall, we figured out increased heat vulnerability patterns along with the areas of South, North, and Southeast Austin. And specifically, the patterns are highly skewed to the East Austin, so-called Eastern Crescent area, which is historically segregated neighborhoods due to the redlining, and heat vulnerability patterns are closely overlapped with those patterns. And the next map shows the result of the bivariate maps overlapping the heat vulnerability with EMS response time on the left and with the EMS count on the right. So the highest level of the concurrence in heat vulnerability and the heat-related EMS response time appears in the block groups in the peri-urban fringes in the East and North Austin, which means EMS take more time to reach the scene and to transport patient to the hospital in these areas. And as for the EMS count, urban centers and East Austin, and specifically Hispanic communities in the North Austin area, has the most overlaps between the heat vulnerability and the heat-related EMS cases. For a deeper understanding of the impact of the heat vulnerability on the EMS incident, we conducted a negative binomial regression model with the EMS count values by the block group level. So generally, the areas with a higher percentage of impervious areas, Hispanic, Black, and persons living alone, and the elderly have the statistically significant effect on increasing the rate of the EMS incidents. In contrast, the areas with the higher percentage of the children, road density, green space, and housing density are more likely to decrease the rate of EMS incidents in the overall period and during each month. So as we delve into our findings, it's clear that higher heat exposure and sensitivity coupled with the lower adaptive capacity escalate the heat-related EMS incidents, especially in the vulnerable neighborhoods. And these findings aligned with the previous studies as well. We also found that the locations with the higher heat vulnerability have a higher climate change disadvantages, worsening our community resilience. Our spatial mapping for the heat vulnerability actually reaffirms to the city and the community practitioners that areas like the Eastern Crescent in the East Austin area are not only segregated by the socioeconomic resources and urban infrastructure and private public investment, but are also disproportionately influenced by the climate risk, with a higher heat vulnerability and limited EMS services. So our study also highlights major climate risk and health disparities that are really rooted in the historical disinvestment and segregation. So we suggest some climate adaptation policies need careful for those populations affected by such place-based inequalities.
2 minutes.
Okay. So as I'm wrapping up the presentation, let's reflect on the profound economic effect of the extreme heat and drought on the Texas water systems. So the damage to our water infrastructure is costing millions to fix. So it's also putting extra pressures on the public health and the emergency services, which needs water for the patient's care and the firefighting as well. These kinds of damages and the challenges in managing it are likely to happen more in certain areas and making the impact even more severe. And the way forward requires some concerted actions, which will be prioritizing the investment in the resilient infrastructure and enforcing some water conservation measures and enhancing the adaptive capacity of our emergency services, particularly for extremely heat vulnerable areas. So it calls for our actions to protect our communities and mitigate the financial and human cost of these increasingly frequent climate challenges. Yeah. Thank you for listening. And yeah, now I open the floors for the questions. I'm happy to answer for that.
Thank you, Kijin. If you have any question, please raise your hands or write it in Q&A, please. Jay?
Thank you, Kijin. That was very interesting. I wonder how much you are working with Travis County Emergency Medical Services and how much they are sharing their data, how much you're revealing these results, and if there seems to be action on the way to mitigate these disparities in response time and number of incidents, etc.
Yeah, we are collaborating closely with the Austin Travis County Emergency Services, and they are providing us the emergency medical service data. And mostly the incident data, and it also has some kinds of patient's symptoms, but it's de-identified for the patient's information. But we are still keep tracking how the heat vulnerability and the heat waves impact on the some heat-related emergency. And I think, I'm not sure about the exact numbers, but we are also seeing that every summer, especially in August, there's a big jump in emergencies. So now, not all of these are because of the hot weather, but it's sure that some play a big part affecting some how our bodies work or its metabolism. So this August, I remember we hit around the 12,400 EMS cases, which is the really highest we've seen in the last 3 years. So it definitely affects the EMS incident, increase of the EMS incident.
Sure. Thank you. If I could follow up with a somewhat naive question, because I'm not sure how it all works, but how much of what they're providing you data, which is obviously very valuable, it's an important collaboration, how much are they taking your results and saying, oh, we can use this now that we can see these disparities, we could use this to change our procedures, or how much of it is, well, as long as you have this disparate exposure to heat, until you could change that, which requires, stopping climate change, rebuilding cities, and all the rest, how much are they able to mitigate in response to your results that you share with them?
We are keep sharing our research outputs with the EMS department, and I expect they are just adapting our research outcomes to their policy implications and other programs in the future. But I'm not exactly sure how much they will be adapted for our research outcomes.
Thank you.
Thank you, Kijin. If someone else has more questions, you can ask later during the